Hello, everyone. My name is Kennedy Fletcher, and today I will be debriefing the case of Trevor. So, first question is, will you be able to work with Trevor? Why or why not? So, I want to start off by saying yes, I would work with Trevor. He does need help, and as social workers, it's our responsibility to serve clients who are struggling, even when the situation feels challenging or uncertain. But I do want to add that I would seek guidance from a supervisor concerning this case, just because it does involve several complex issues, such as his hallucinations, the trauma that he's been through, and there's nothing wrong with asking for help. I think actually it is the most ethical thing to do in a complex case like this. And at the end of the day, we want to make sure that Trevor gets the best possible care. Um, I'd also recognize my feelings, working with a client who has walked out of a room or talks to people who aren't there. It can feel uncomfortable and scary at first, but that's okay. Like I said, with asking for help from a superior, so receiving proper supervision and support, I do believe that I would be able to um, create and build a relationship with Trevor over time, to help him. So, question number two, what tentative diagnosis would you consider and do you see more? So, first, the diagnosis that I would consider is a psychotic disorder, psychosis. Since Trevor is experiencing hallucinations, he's seeing things he doesn't see, like the dog on his bed. Um, and he's feeling bugs on his skin that aren't there. And he's, actively speaking with the things that he's seeing, as well as he mentioned that his father tells him things, but his father isn't present. So those are signs of psychosis. Moving forward, I would say he could possibly have trauma-related disorders, maybe PTSD, um, or having symptoms of disassociation. Okay, and last, I would I would just ask questions concerning maybe like possible substance use. Moving on to the third question. What would you do after Trevor stood up and walked out? So this is a very important moment right here. For me, I would stay calm. I would probably go see where he went, but I wouldn't chase after him or run after him. I would, be respectful with the distance between us, just to make sure, like, he hasn't left the premises, and ran out maybe in like the street towards any danger. So say he isn't still in the area that we're in, I would try to gently approach him and ask him, if he's okay. I understand that he needed to leave. I'm still here to talk if he is up to talking. And just let him know that I just wanted to make sure that he is safe. I wouldn't force anything upon him, like coming back to finish the conversation if he does not want to. I just want to make sure that he knows that he can trust me, and that I'm not trying to pressure him into anything. I would want to give him space, continue to give him space, and if he is willing to talk, validate the things that he says, and try to move forward from there. If he does leave the premises as a whole, I know that I would probably have to reach out to other superiors, other professionals to locate him. And last, after the situation is resolved, of course, document everything that transpired, we don't document it, it didn't happen. And of course, at the end, I would debrief everything with my supervisor, and continue to plan next steps as soon as possible. But the overall goal is to just make sure that Trevor is safe, and to possibly preserve a therapeutic relationship in the future.